This slideshow is about COVID-19 and what I think students might need to know or like to know. The reason that I am making this presentation is that I have found a lot of students have misunderstandings or even missing information about this pandemic we've been going through now for over a year and a half. However, watching this video is optional. If you don't want to learn any more about COVID-19, the disease, the vaccines, etc., then please stop here and there will be no penalty. Let me give you just a few reasons why I am concerned. After just 3 days of school, JCPS already reported 63 positive COVID-19 cases among students. There were over 250 students that had to be quarantined as a result. There's also about 30 staff members that are involved. Today, I'm recording this on Monday the 16th, and we have yet even more cases. So this is something that is affecting students, and it's affecting the school. Just some other examples that I saw over the weekend. In Mississippi, 5,000 new cases on Friday. That was a high. Most other people's states' highs occurred back in like January. And what's happening is there's a new variant known as the Delta variant that is spreading across the country. It's starting in the south and the west, and it is headed up toward the northeast. It's coming right through Kentucky right now. Just as another example, Florida last week reported 151,000 new COVID cases. The week before that was a record high. Well, this beat that record by 20,000 cases. Most of the people that are getting sick in Florida are younger individuals between 20 and 39 years old, and a lot of the people that are dying are much younger than the ones that were dying a year ago. Almost all of these very sick people, the ones that get hospitalized and the ones that die, are not vaccinated. Here's another example of where things stand right now. On August the 15th, that was Sunday, the 7-day average in the U.S. was almost 131,000 cases. A year ago, that was 52,500. We're 2.5 times off worse now than we were then. And look what happened after August of last year. That's when the big surge hit, and we went up to 300,000 cases per week in January. If we rise the way we did last time, it's going to be 2 or 3 times higher than that 300,000 cases. That's just unacceptable. We almost brought this thing to a stop. Look at back late May, early June. There were probably less than 10,000 cases a week. But something happened, and what that something was the Delta variant. This new variant called the Delta is 2 to 2.5 times more spreadable, more catchable than the previous versions of COVID. Look at this set of graphs. You can see where the high contagion regions are in red and pretty high in orange as of July the 5th, and then compare that to a month later. I bet if we saw the graph today, almost all of the United States would be red. It's really spread across the country like wildfire. I found that most students don't even know that COVID is just shortened for coronavirus disease. The 19 refers to 2019, the year it was first identified as a novel virus, meaning that it was first identified in people. We had known about coronaviruses in animals, but now at least 3 different ones have made it into the human line. The actual virus itself, this is an artist rendering. This is not what it actually looks like. It's a computer model. But it's known as SARS-CoV-2. That again is shorthand. It means severe acute respiratory syndrome, coronavirus number 2. It turns out there was a SARS number 1. They didn't call it number 1 because they never expected to see it again, and yet here it is. This one's different from the original SARS, but it is close enough that they named it number 2. So again, what I'm saying is the virus itself has a name. The disease it causes has a slightly different name. SARS-CoV-2 is the virus. COVID-19 is the disease. Now the coronavirus is a type of virus. There are lots of different types of viruses. It turns out that the coronavirus is in its own family, the Coronaviridae, and it has several genuses, alpha, beta, and gamma. The beta type is what we have right now, and if you look down at the bottom of the screen, you'll see in blue SARS-CoV-2. That's the virus we have now, but right before that is SARS-CoV. That one was a few years ago, and then right before that is another one, MERS-CoV. That stands for Middle Eastern Respiratory Syndrome. And then, of course, the SARS is the same as it is for the current one, Severe Acute Respiratory Syndrome. There was another COVID that was back in the, coronavirus back in the 1960s before they even identified it as a coronavirus that caused a cold. These new viruses are much more severe. They cause a lot worse sickness and in some cases death. So something's happening to make this effect in humans. What is that? We have to understand that a virus, this is a cutaway view of a coronavirus, is not exactly what you might call a living organism, because it doesn't really have organs. It's much, much smaller than a cell. They're very, very tiny. And instead of DNA, they just contain a strand of RNA. It's basically messenger RNA. And if that virus can attach to a cell, it will inject that RNA into the cell and trick the cell into making what the RNA is coded for. In other words, more copies of the virus. So those little spikes on the outside, that's what attaches to a cell. Now, the original coronaviruses are animal viruses, but every now and then, a slight mutation in that RNA strand might occur, and if that mutation changes that protein on the outside, those little spike proteins, it might then be able to attach to a human cell. And that appears to be what has happened here. The coronaviruses that are closest in genetic sequence to the one that we're experiencing now are found in certain bats, and those bats are found in China. So it appears that some bats sneezed on some people. Yes, bats are mammals and they can catch colds too, and the people then got infected by this virus, which usually wouldn't be a problem because there would be nowhere for it to attach. But somehow there was a slight mutation that allowed it to attach in at least one human's cells, and the next thing you know, that human got sick and infected other people. Now again, viruses are extremely small. If you look at this electron micrograph, you'll see what it actually looks like if you could magnify it tens of thousands of times. Those little spikes on the outside are very faint and indistinct in this electron micrograph, but when they were first seen, this reminded somebody of a crown on top of somebody's head. And so that's where corona comes from. It's actually Latin for crown. So instead of calling them crown viruses, they made it sound more scientific by calling it coronavirus. Anyway, apparently these viruses are just found in animals in nature, and like I said, with a slight mutation, they can infect people. The one that caused MERS, for example, the Middle Eastern Respiratory Syndrome, was found in camels, and that's why it was found first in the Middle East. So the SARS may come from bats, or some people say it might come from the pangolin, which is a type of anteater, which is also found over in China. We don't know for sure. Nobody will ever know exactly who the first patient was and exactly how he or she got the disease. What's made this so insidious and different from MERS and the original SARS is that those diseases made you sick pretty quick. They made you severely ill, and doctors recognized it as a new illness very, very quickly. In this case, it appears to be spread by droplets when you sneeze on somebody or cough on somebody or just breathe on somebody, but it doesn't make you sick right away. It might be 2 to 14 days before you show any symptoms, and it turns out that a lot of people don't show any symptoms at all. So this virus has been rather insidious in that a lot of people are spreading it without knowing it, and that's how it got around the world and became a pandemic. Pandemic just means, in Greek, all people. It just means it's something that everybody needs to be worried about. So, like I said, the COVID-19 symptoms may not even appear until after you've already been contagious and affected other people. Now, it is most contagious when you are the most sick. So that's when you especially need to be wearing a mask, even if you're at home. Make people stay away from you if you have any of these COVID-19 symptoms. What are the symptoms? Well, they're kind of like a normal cold in a lot of ways. You got fever, cough, shortness of breath, maybe a sore throat, runny nose, stuffy nose, body aches, headache, chills, and maybe you feel tired. You can also have diarrhea and or nausea. Kind of a unique symptom is the loss of smell and taste, but not everybody gets that. If you feel any of these symptoms, you need to stay home. Don't come to school. This is not a normal school year, okay? If you feel anything off, just stay home, find out what's wrong with you before you start exposing yourself not only to school, but to other people. Most people that get COVID do just fine. They might have some cold symptoms and then they get better. Some people get a little more sick. And if you have difficulty breathing, shortness of breath, that's when you need to go to the hospital. Otherwise, call the doctor and talk to the doctor and find out what the doctor recommends. So it can cause a wide range of illnesses, and one of the strange things about this disease, like I said, some people don't get sick at all, some other people get very sick and even die from it, and we don't know who that is going to be up front. You don't know whether you're a person that's very susceptible to it or not. It does seem to have affected the elderly a lot more, and doctors think that's because elderly people have weaker immune systems. They aren't able to fight it off. It also affects people that have pre-existing conditions, things like diabetes, because again, their immune system is probably weaker. It's already trying to do so much with the disease that you already have that it doesn't have enough resources to fight off the SARS-CoV-2 virus too. But you just don't know. Some perfectly healthy people have caught this disease and are no longer with us, and that's just so sad. I don't want you to get sick. I don't want your family to get sick. I want you to be at school. And so what can we do about it? Well, the number one thing that the CDC recommends and other health organizations recommend is that you wear a mask and you wear it properly over your mouth and your nose. It's not really doing any good if you have it under your nose or under your chin. It's just annoying you. If you have it over your mouth and your nose, yes, it's annoying, but at least it's protecting you. You should avoid close contact with others, socially distant, in other words. Avoid crowds with poorly ventilated spaces. This really worries me that I heard stories about students standing on the buses because the buses were so packed the first week of school. And people were hot and they were pulling their masks down because they were hot. That's the last place you want to pull your mask down, in a crowded space. You need to keep it up over your nose. Wash your hands with soap and water. The soap breaks up those spike proteins on the outside of the coronavirus, and so it can't attach. Hand sanitizer is after that. So yes, you can use hand sanitizer, but nothing beats soap and water. People can spray this out, and it can stick around on surfaces for a little while in little droplets of your spit. So if you touch that and then touch some part of your body, you might also get infected. The worst places to touch are places that are moist, because if you touch something moist, get some spit on your hand and then touch your eyes, your nose, or your mouth, it's a very easy way to transfer things through the moisture. You should clean and disinfect frequently touched surfaces with some sort of microorganism disinfectant, and if you can, get a COVID-19 vaccine. Almost all of those people that you saw on the first slide that are at home right now that are quarantined are people that haven't had the vaccine. If you get the vaccine, you do not have to quarantine after exposure unless you too are exhibiting symptoms. Now, not everybody can get a vaccine, so who can? What's the big deal with vaccines? Let's talk about vaccines for a little bit. Some people say, well, I already had coronavirus. Does that give me protection? Yes, it does give you some. But what doctors seem to be finding, what studies seem to be showing, is that if you get the coronavirus, you're protected against that strain, but not necessarily other strains. And so it doesn't offer as much protection as the vaccines. The vaccines help your body to learn how to be immune to the disease. It may help you, even if you get the disease, not to get very sick. and especially not to die. In fact, last week they reported in the literature that I was reading that more than 99.99% of people who are fully vaccinated are not getting sick. So you do hear about these breakthrough cases, people that have been vaccinated and they get sick, but it's not very many people. And even those people are not getting as sick, and they're not dying in as great a numbers. In fact, the latest statistics I could find, 164 million people in the U.S. are fully vaccinated. Only 1,500 of those people died from COVID. So it's a very, very tiny fraction. Again, a vaccine may protect you against getting the disease. If you get the disease, it may help it to be less severe and shorter in duration, and it may be a very good way to protect you against dying from the disease. So I highly recommend vaccines if you can get one. So there are certain cases where you can't get one. Maybe it's some disease that you have. Maybe you just had COVID. You're going to have to wait till you're over the symptoms. You know, you've just been exposed. You probably should wait until you see whether you develop it or not. But talk to a doctor. Talk to a medical professional. I'm not a medical professional. I'm giving you this advice as a science teacher. I do have degrees in biology. I am a well-informed individual. I've looked all this information up so I can inform my students. On the other hand, there's no substitute for talking to your doctor. If you had some other medical question, who would you talk to? I would hope it'd be your doctor. So talk to a doctor about getting vaccinated if you haven't already been. Right now in the U.S., there are 3 vaccine companies that make a product that have emergency use authorization from the Food and Drug Administration. That's the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson. Now the first two, Pfizer and Moderna, are a new type of technology for vaccinations. They're not a new technology per se. These vaccines were approved with sort of an emergency use, full, what do they call it, authorization, I guess, is probably going to be coming in the next few weeks. But the Pfizer and Moderna require 2 doses about 3 or 4 weeks apart. They seem to be very effective in clinical studies. And they're made with, like I said, this new sort of messenger RNA technology where they basically insert just a strand of the messenger RNA into your arm, and that's enough to teach some of your cells to start fighting off the virus. And all that messenger RNA does is it encodes for those little spikes. It doesn't make the whole virus. So you are not given a virus, you're not given DNA, you're given a small strand of RNA that's just big enough to make the little spike proteins that your body can come to recognize as something foreign and then make antibodies against. The Johnson & Johnson vaccine is an older technology where a real virus is injected with some of the mRNA from the coronavirus, and then that virus is introduced into your body. Either, a lot of times they're already dead. But the point is that is older technology, is more common sort of way of doing it. And so some people think that it might be better. So which one's better? Well, there's no way to tell. The Johnson & Johnson vaccine seems to work very good against people being hospitalized. They may catch the disease, but they don't get a severe case of it or die from it. So, but it's almost impossible to compare them because they were done at there's 3 different vaccines that we are emergency authorized to use in the U.S. were made at different times. So different strains of COVID were out there. They were studied in different populations. So you can't really compare them directly. But the point is that there are no vaccines in the United States that use a live virus. They cannot change or modify your DNA. They just basically make the instructions for making that little spike. And then your body comes to recognize that as something that it should not be making. The RNA goes into your cell, tells your cell to make things. Well, your cell makes them for a while, but then it comes to recognize that it's wasting its time, that that's not part of the normal cell. And so some white blood cells will come over and will start recognizing this little protein and say, oh, every time we see that from now on, we're going to destroy it. So we're not going to let it get into our cells again, and so you won't get sick. So some people are concerned that the vaccines have been sort of moving too fast. They have gone fast compared to historical vaccines, but we have a lot better technology now than in the past. And the mRNA, the Moderna and Pfizer type of vaccines, they were able to make them very quickly. But the studies that have been conducted on them have been very, very thorough, and they're following all the guidelines. Nobody's going to let them skip a step. So as far as we know, these things are fairly safe, but they're still studying them. So as far as we know, these COVID-19s are very safe for most people. The CDC, Center for Disease Control, recommends that you get a COVID-19 as soon as possible, because after about 2 weeks after your final dose, then you can resume normal activities. Like I said, you don't even have to get quarantined if you're around other people, as long as you don't exhibit symptoms yourself. There have been tens of thousands of people that were included in the studies, and since then, everybody that gets a vaccine, is monitored in one way or another. If you get sick, you report it to the doctor, and the doctor reports it to the CDC. So the vaccines do have some side effects. Don't get me wrong. There are some risks in any sort of vaccination. I got a vaccine over the weekend against shingles, a different disease. This is exactly the same list of potential symptoms that the pharmacist gave me for that vaccine: swelling, redness, and pain at the injection site, fever, headache, tiredness, muscle pain, chills, and nausea. This especially appears to occur after the second dose if you get the Pfizer or the Moderna. And that's because the body is recognizing there's a foreign agent in it, and it's diverting resources and energy to fight it off. Energy and resources that normally your body would be doing to make you feel good. And so you don't feel as good for a little while. When I got my second shot, I was not feeling very good. I had sort of fever for a little while and chills for a while, for about 5 hours. But after that, I felt just fine. There have been a few cases of more severe reactions. There have been very few people that had a severe allergic reaction that caused anaphylaxis. This is the same sort of reaction that occurs in people that have like peanut allergies or nut allergies or shellfish allergies. That's one of the reasons why they make you wait 15 to 30 minutes after you get the shot. If you start having this severe allergic reaction, it usually comes on pretty quick. And if you're there in the nurse's office or doctor's office or pharmacy, they can give you an EpiPen shot or something like that, and you'll probably recover without too much trouble. That's my prediction. Again, I'm not a doctor. Now, there was a bit of a concern, and it stopped the Johnson & Johnson vaccine for a couple of weeks while they looked at it, in that there were a few women of childbearing age who developed a syndrome called TTS, thrombosis with thrombocytopenia syndrome. And basically what happens is your platelets clot up in some parts of your body, and there's not enough to make clots in other parts. So it's almost like you're kind of a more anemic at the same time that your blood is clotting in other places. This is, again, curable. Most of the people that get this, they can help out pretty well. The incidence of TTS is extremely rare. It's 0.0007%, and it's almost exclusively in women of childbearing age. There's also a very small risk if you're a male from the Pfizer and Moderna vaccines of having some sort of heart inflammation. Again, you might feel like a tightness around your heart, some pain in your chest or something like that, shortness of breath. You tell the doctor will give you steroids or corticosteroids and then maybe an immunoglobulin treatment, and most people are recovering just fine in a short amount of time. Now, again, it's not, zero risk. But the point is, like for women, if you're afraid of TTS, well, just get the Pfizer or Moderna, because there's only been one Moderna report that I read about out of millions of shots where somebody developed a TTS. And the men, like I said, this condition is rare and it's recoverable. So what about all those other things that you hear about? Well, let me just first put it like this. If you're afraid of the unknown, like I might get something with a 0.0006% chance, the chances of you getting COVID without a vaccine is 11%. 35 million people in this country have had COVID, and there's only 328 million people. That's 11% of the people have actually caught it. So your chances of actually getting the disease is much, much higher than your possible chances of having one of these rare side effects. But I know that you've heard about other side effects out there. For example, there might be women that are afraid that it's affecting their ability to get pregnant, or it might affect their babies. There is no evidence of that. Okay, vaccines seem to be safe and effective. The best one of the three types, by the way, I said earlier, it's not really possible to compare them. The best one's the one that's in your arm. But if you don't get vaccinated because you're afraid of some possible future side effect, then you really need to talk to your parents and you need to talk to medical professionals, because like I said, the chance of you actually getting COVID is very, very high. And I don't want that. I don't want you to get sick. I don't want you to make other people sick. I'd rather that you talk to a medical professional and get some good advice. They may know things that I don't know. Like I said, I'm not a medical professional, but I've just been trying to stay up to date and look this stuff up so that when students have questions, I can answer those questions. So please learn about these COVID-19 vaccines. Learn about possible side effects. Talk to a medical professional. Go and get your shot if you can. Some people can't get it. They have immune compromised systems. Maybe it won't work. Some people are going to need more than one shot. I'm getting ahead of myself there. I'll answer that question again in just a minute. But there are some side effects. You've got to weigh the benefits and the risks. So talk to a professional. So while I was talking to students, they brought up some questions. So let me just address a few of those questions here in no particular order. Is there any long-term safety concern for the vaccines? Not yet. I'll tell you this, that in the history of vaccinations in the modern era, let's say the 1900s and the 2000s, if there have been any severe problems at all with a vaccine that's under study, they've all come up within the first 6 weeks. These vaccines are over 6 months old. In other words, it doesn't seem very likely that some kind of future problem is going to pop up after we've already given it to millions and millions of people. It looks like we would have seen those problems by now. But stay tuned. When will younger people get the vaccine? It probably, in my opinion, will be a few months, maybe say December. It's a lot harder to get permission to study the effects of medical procedures on children. A lot fewer children get studied, and so it takes longer to gather enough data to come to valid conclusions. There's a lot of processes that have to go, medical professionals have to go through just to get a study approved. Then they have to recruit volunteers. They have to explain the risks and benefits to those volunteers, have to get them to agree, and then they have to monitor them. Well, they always do this with adults first because they can make their own decisions. Then they go down to teenagers, people that are going through puberty, and then the last group that ever gets even picked to study are the children. We try to protect our children. So it's going to take a few more months before the children's trials are complete, but they are ongoing. Will the vaccine change my DNA, make me mutate in some way? No. It's RNA, not DNA. It doesn't go in your nucleus. It doesn't change your DNA in any way. And as soon as a RNA goes into your body and gets read by the cell to start making copies, it gets destroyed. So it doesn't even stick around. So the vaccines are safe in that sense. The vaccines don't have a live virus. So you may have heard stories where people get the vaccine and then a couple of days later they get sick. Well, it wasn't from the vaccine. The vaccine doesn't have the entire RNA sequence. It can't make an entire virus from it. So if people get sick from coronavirus, it's because they got coronavirus from some other source. My father-in-law, for example, got the vaccine and a couple of days later tested positive. And he thought he got it from the vaccine, but the doctor explained to him, no, you probably had the disease and just didn't know it when you came in here, because the symptoms don't show up until 2 to 12 days later after you've been infected. Will I need to get a COVID shot more than this year? We don't know for sure. They've already authorized this week people that are immune compromised or maybe they were on antiviral treatment or something like that, they do need a third shot because maybe their immune system didn't work so well. It wouldn't surprise me a bit if in the next month they tell me, people my age, 60 and over, that we need to get a third shot because our immune systems don't work as well as younger people, and so maybe we need a little bit better protection. But if this Delta strain, for example, doesn't go away, they may have to make a vaccine just against it. If other new strains arise, they may have to make vaccines against them. So it'll be kind of like the flu. The flu can be out on the other side of the world right now, for example, and CDC and the WHO and other doctors like that will study what strains are over there, and then they'll come over here and they'll say, well, we saw the type A strain or the type C strain or whatever, and they'll make vaccines against that for us. The flu vaccine might have 2 or 3 different strains in it, but that's really their best guess about which one is going to make its way over here. Same thing for COVID. They're going to have to monitor for this now for the rest of our lives. And if they see a new strain arising somewhere, there may in fact have to be a new vaccine. We just don't know. You'll have to stay tuned. If you had COVID, I mentioned this earlier, it does give you some immune response, but the vaccines seem to be even more effective. So doctors recommend that even if you had COVID, that you go and get the vaccine. Is there a microchip in the vaccine? This is an actual rumor that's going around. No, there's no microchip in it. In fact, I don't think that they can make one that small that you could fit through a syringe needle, the size of the one that they give the COVID shot with. But they don't need a microchip to track you. There's already one in your cell phone that's perfectly capable of telling the government where you are and what you're spending your time and money on. I hope they're not tracking us, but they don't need a microchip and a vaccine to do that. They've already got that technology in your phone. So I really wouldn't worry about this. Why do some governors pass a ban on masks? Now we're getting into politics, about which, I am not an expert, but it's really not even as much about politics as it is about the way people are. People have beliefs. They have belief systems. Some beliefs are more deeply held core values than others. And so there is a branch of some people in the country and around the world, this is not just a U.S. phenomenon, that have this very strong belief that's part of their core value system about the way they live their life, that the government should govern, yes, but in sort of a limited way. And they shouldn't reach right into your house and tell you exactly every little thing that you should be doing. And this wearing of a mask crossed a line for them. It was just too much intrusion. And again, they're not doing it as some sort of political stunt or anything like that. It's their beliefs. It's their core belief. And because it's so deeply held, they're going to have a hard time changing that idea. Because to change a deeply held core belief means to change your whole self. And people like themselves already, they're not going to be willing to change. So, you don't need to be arguing with these people. And if they're in power like a governor, they can impose their will on other people and say, hey, we're just not going to have any more masks. We're not going to have mandates about masks because that's just too intrusive. But that's their value system. And that's why we elect these people. We get a majority of people together, we vote, and those are the people that get elected that we think have values similar to our own. And so in some states, the governors have imposed these bans. I personally think it was a mistake. I think that's what the data is showing now, because places where the masks have been banned are having a really tough time with this Delta variant. On the other hand, you don't need to wait for the government to tell you to wear a mask, I would hope. From now on, the rest of your life, if you see a disease that seems to be of concern, please put a mask on. Don't wait till somebody has to mandate it for you. When I go into Walmart or Kmart or Kroger or Thornton's or whatever, I have a mask on right now. Nobody has to tell me to do that because I see the data. I see that COVID is still spreading, and I don't want to catch it, and I don't want to give it to anybody. So I put a mask on even though nobody's told me to do that. And the one of most concern to most students is more NTI in our future. Short answer, no. There's no money for that. There's no plan for that. We have no way of doing NTI or even hybrid as far as I know. but I'm not on the inside there. I'm on the outside just like you, and I get my news the same way you do most of the time. I hear it at the same time you hear it. But as far as I know, they're going to try to stick this out. They're going to try to ride it out as best as they can. It's really concerning. The cases are spreading. Hospitals are starting to get really full and packed again. It's looking a lot like it did last October or so, when it got really bad then in November. That's the way it's looking. But right now, there's no plan for that. The plan is to stay in school. The thing that concerns me is what happens if a lot of teachers get sick or a lot of substitutes, because you can't go to school if you don't have a teacher. So right now, if you get sick or you get quarantined, you're sent home, and there are teachers that are hopefully working with you virtually. They're supposed to send you some sort of code, and you're supposed to go online and get some sort of help. I would hope you would contact your teachers if you're at home right now and get assignments from them so you won't get behind in class. But as far as I know, there is no plan to go back to NTI. Let's cross our fingers on that and just hope for the best. Now, I went through this very fast. I hope you could hear it. I know my sound system is not the best. I don't have a separate microphone that I could hook up here. But I've just done my best to present some of the facts. What I want you to do is, if you're not vaccinated, talk to your parents or guardians about it. I know sometimes students tell me, oh, my parents won't let me get it. And I ask them, well, have you really talked about it? And they think that their parents think one way, but they haven't really asked them. So talk to parents, talk to medical professionals, and get some opinions. Now, if your parents and your guardians say no, you got to respect that. They are your parents. They're trying to pass their value system onto you, and they're trying to live out their beliefs, and that's what people do. So just wear a mask, wash your hands, socially distant if you can, stay home if you feel sick, and when you get older and of age, say 18, and can make your own decisions, get information and make good decisions for yourself based on your own beliefs. So this is Dr. Kemp signing off. If you got any questions, be sure to email me.